Here we've got 5 different breast implants, all different sizes. How do you select the right size breast implant for you? This is a conversation between your surgeon and yourself. You'll need to tell them about your goals. You'll need to do an examination of your anatomy. And from that, you'll ultimately get towards the size. In addition, you've obviously got to pick a brand of breast implants, a degree of softness, a texture, whether you want anatomical or round. And you've got 4 different projections here, and this one actually belongs in this projection, believe it or not, but it's just a lot smaller because it's more narrower. So one of the things that we do when we're sizing patients is we actually measure the chest. So we will measure, okay, there's the inner aspect of the chest, and then where does the outer boundary of the chest go to? For example, that may be about 12 centimeters you might measure. And so you want to have your breast implant to be about 1 centimeter, usually less than what the limits are. Now you vary that. So for example, if someone's got very thin soft tissues, you may want the breast implant to be a bit bigger than 1 centimeter less. You may also look at how much cleavage they want, or whether they want a very full lateral aspect. So this is where talking about the goals helps to influence the size that one chooses. Once you select a particular width of breast implant in accordance with the breast width and that calculation that I've just mentioned, you then have a number of different projections. So what I do is I would actually get patients to try them on. So they would be wearing a surgical bra, for instance, that's appropriate for them, and they'd actually put the breast implant in, and you would be able to take them through these, and they'll go, you know, I like this one, or actually I like this one more. And you can compare 2 of the same on both sides, or you can compare, for example, a full projection with a moderate projection, and you can compare and see, okay, which one do I like more? I get them to do that and look in the mirror. They may bring a friend with them who'd also give an opinion. They can put their shirt on, they can take selfies, they can take photos, and that helps give an idea about what they want. And obviously, you can only do what you can accommodate within their own soft tissues and their, how much of a capacity their pocket will ultimately have. And that's based on your sort of look, feel, move exam and seeing. So they may be able to accommodate this one and this one, or this one and this one. They may have already got breast implants, and that gives you a degree of understanding about the size that it can accommodate, how much loose tissues they've got, what's happened over the passage of time. And so you can come to narrowing this down to maybe 2 different projections that they could have. And you would be able to compare both of those in a surgical bra and go, okay, this is what you can have. Which one do you like better? What would work best for you? What would achieve your goals? And there's probably a degree of R-ing sometimes about this, bit of back and forth, bit of looking at it, comparing, and that can be a variable length of time depending on different patients and how quickly they make decisions. But it's very important that we give them the amount of time and space to do that. Sometimes we'll order 2 different projections, i.e. 2 different sizes, and have them both available on the day of surgery, and that gives them time to consider their options, gives them a bit more amount of time. And also, you may be concerned as a surgeon that you can't actually fit the bigger one, so you may want to have a back out once you've created the pocket, and you can do that. And just to illustrate these different implants, this one here is a low projection and it's 250cc. This one here is a moderate projection and it is a 340cc, also known in this range as demi. This one here is a full projection and it's 450cc, and this one here is ultra, also known as ultra full or corset, and this is a 650cc. So you've got different sizes, but they're all the same diameter across because they're different projections and they're different sizes therefore. And in addition to going through the different sort of projections and sizes of implants and trying them on, the other thing that you do is show them befores and afters. So we've got pictures that we can look at, we've got the website, we've got Instagram, and you can have a look at how they actually look, different CCs. Now obviously patients often come in and go, well, I like the way she looks, but they've got a different anatomy, they've got a different situation beforehand, so you have to often say that that looks good with that patient and their particular base width and their degree of soft tissue laxity, how easy it is to move their soft tissues and how much space they had. And so you can't always compare exactly with a different patient and go, okay, they look good with a 320cc, so therefore I want a 320cc. Each and every time it's a bespoke decision for that individual patient as to what will fit their frame and what would fit their goals. But this is how you'd size patients. It's a very interesting process. It's probably one of the fun parts of the consultation where you get to try different things on. You've already made a lot of decisions already by this stage, so now you're just focusing on almost the last thing, which is what size you want to try. And that's a fun part of the process, and we always look forward to doing it, and patients often have a lot of fun as well if they've got their friends with them as well. Then it can be an entertaining part of the consultation, giving a bit of light relief to everything else, so it's quite a lot of fun. But that's how we size patients.